Well, hi there. My name is Chuck Gerard, and I'm the coordinator of Whitebird Clinic here in Eugene, Oregon. And we're standing outside the main clinic. We're going to go inside in just a little bit and tell you more about Whitebird. But we've been doing human services work for more than 4 decades now. And last year, I think we had about 85,000 contacts at our 8 programs, all nested right here within a 2.5 block radius of downtown Eugene. And so why don't we go inside and I'll tell you more about Whitebird. Well, here we are on the inside of the building, 341 East 12th, and that's what we think of as the main Whitebird Clinic building. Whitebird started about 40 years ago, initially responding to community needs. There were people that weren't getting their needs taken care of, they weren't getting the care that they needed. There was a lot of younger people coming out of the 60s, runaways and disenfranchised people, and so a group of people banded together and formed Whitebird to create a response to that. Initially Whitebird's socio-medical aid station, later became Whitebird Clinic. And so for about 40 years our mission has been the same, which is to try and help people that weren't getting the care they need. And that includes a lot of people with physical and mental disabilities, and more recently folks who are homeless, but still alienated, disenfranchised, still not trusting the mainstream systems, but coming to trust us. And that comes out of our experience and our reputation and word of mouth. And over the years we've become less of an experiment and more integrated into the systems. So out of this building, we're currently the Lane County's Crisis Center and Lane County's Information Referral Center. We have a project called Cahoots, where we have a van staffed by a medic and a crisis worker that's dispatched through the 911 system. We're the only one like that in the country. And we have ongoing counseling, mental health treatment here. And then the administrative services, and that's all contained in this building. There are a lot of us and we're pretty packed in. Fortunately we get along pretty well, so it works out. Building next door, when we bought this property, it was a double lot, and there we have our outpatient alcohol and drug treatment program. And an adjunct to that is acupuncture detoxification, which is comes out of a model that was tried out in the Bronx, actually, in New York, and was found to be very successful. And one of the people that worked there moved out this way and helped us get it started. 2.5 blocks from here we have a small building on the corner of 13th and Ferry, and that's where our homeless case managers and our benefits advocacy person works to try and get people on mainstream benefits and entitlements. Slightly offset from there, but also 2.5 blocks from here at 1400 Mill is where we have our medical and dental clinics. And we do a lot of indigent work and homeless work, partly funded by the feds and the state and the county, and some of our projects by city and foundations. But it all works together to put together a model of continuum of care and health care beyond just medical, but a wider approach to health care, trying to look at it holistically and trying to work together for the care of the patients or clients. So that's primarily the work we do here. It's pretty complicated, and folks talk about there being a safety net of services, and in some ways we think of ourselves as under the safety net because a net has holes in it and people drop through those, and we try and be here to catch them. So we're really in the trenches, and it's very difficult and complex work, and it's probably some days the most important work that can be done. So in addition to our buildings, Cahoots is out in the streets in the van, and we have outreach workers that go try and find homeless folks and bring them on in to help get care that they need. And so it's a variety of services that we do. We also do event work. We do what we call rock medicine. And that's where we provide crisis and medical care to events out in the community. It was originally rock medicine because it was rock concerts, and those days aren't quite as exciting anymore, but we still do some events around the state, and there's a reggae festival in Marcola. We go and provide care. When String Cheese Incident comes to Horning's Hideout up west of Portland, we'll do that show. And every year we also do the Oregon Country Fair. And so I think we're going to go there next and show you how that works. Well, hi again. We are now at Whitebird out at the Oregon Country Fair, where we do medical and crisis work for this community. And we've been doing it for about 39 years. And so this weekend is the 5th largest city in the state of Oregon. And we are the medical center, the ER, the primary care. We're the community crisis center. And so we take care of folks if they're hurt or if they're upset or if they're disturbed by anything. We're here to just support the fair family, and we're here to support the public when they come in to visit. And now I think I'd like to show you our booth and bring you inside. Okay, now we're inside the Whitebird booth, and we are set up in stations for levels of care. And so the first station is here at the window, and we have a box of various items that we can hand out to people who don't need intense care, but just need some sort of attention and support or amenities, need a Band-Aid, don't need us to treat them. And so that's what happens up here. And then if it's more serious, we're going to bring them inside into one of our other 3 possible stations. Okay, and the next area is these first aid stations that we have, where we can bring people in and provide minor care. They might have a splinter or a cut foot or some kind of owie that needs our attention but isn't a serious emergency medical situation. So this is equipped to provide that level of care. Okay, we're now in the exam room, which is where the major medicine takes place. And we're fully equipped and staffed, as well as any small hospital. We have medications, and we have an airway tower, we have an IV tower, we're able to do suturing, we're able to do temporary casting. We can pretty much do anything besides x-ray and permanent casting. We have heart monitor equipment, we have the ability to restart a heart, we have all the medicines that are involved to run a code, we have a crash cart. We are fully equipped, and our medical staff, everybody is Oregon licensed. We have doctors, but every shift has at least an ER doc as the lead doc. We have nurses, we have paramedics. Everybody has advanced certifications in advanced cardiac life support or advanced life support or other special certifications. So it's a remarkably highly qualified and wonderful temperament crew. Okay, and this area is our down tent, and it's where we bring people when they're tired or too hot and need to rest, and when we've treated somebody medically in the exam room, and we now need to have them lay down and monitor their vital signs or things like that. We can do follow-up care in here and still take care of the patient until they're ready to be released. Okay, now we're at the back of the booth, and this is where we have our trunks and our containers and all of the materials and supplies that we use to set this up and make a hospital and make a crisis center, and then through the weekend resupply it, or when things break, fix them. So it's a huge infrastructure, it's a huge effort, and we spend a lot of time during the year getting ready for this event. In addition to the country fair, our rock medicine program does other events. We do a couple events up in Portland. We do some locally in Eugene and our Marcola. And this rock medicine work, we love to do it. And we have a dedicated group of volunteers who work really hard. And it's all in support of Whitebird. and it helps in part us do the work that we do all year round for the community. So the other thing I wanted to share with folks that might be seeing this is that we think the work that we're doing is pretty important, and if other people feel that way also, I'd like to tell you about ways that you can help us to do what we do. Obviously, we'll take donations anytime, and we will apply those to the services that we offer. And donations that people give us help underwrite indigent care. That's for people that don't have anything and still need help. Folks don't have or want to give money, we will take your time. If you're in the area, we have special projects you can help pitch in with us and get some stuff done. We have a very elaborate and comprehensive training program for people that want to give time for a while, and we will teach you to do what we do so you can help us do it. If it's not about money or time, there are times during the year where we're gathering blankets and sleeping bags and warm weather and wet weather gear to give out to people who don't have enough. And if it isn't time or money or gear, we'll ask that you just send us good wishes in the work that we're doing. And if you're ever in a rough spot, you can come in and see if we can help you too.